This is the paper I promised I'd get back to, where it's looking at the prophylactic effect of Iota-Carrageenan in hospital personnel, specifically in healthcare workers that work directly with COVID patients. This was a pilot, multi-centered, randomized, double-blind, placebo-controlled study, where they received either an Iota-Carrageenan nasal spray or a placebo, which was saline. They did one spray per nostril, receiving 4 daily doses over the course of 21 days. The incidence of COVID within these healthcare workers was significantly different between groups. Only 2 healthcare workers in the Iota-Carrageenan group contracted COVID, while 10 in the saline placebo group contracted COVID, making a relative risk reduction of about 80%. At first, you might be thinking, oh, 2 and 10 is not really that significant of a difference when you're talking about 200 people. But I'll show you a plot later that really underpins why this is a really big difference, and why the Iota-Carrageenan nasal spray showed significant efficacy in preventing COVID-19 in healthcare workers managing patients with COVID. For the mechanism of action of how Iota-Carrageenan works, it inhibits viruses due to its interaction with the surface viral particles, thereby preventing them from entering cells and trapping the viral particles released from the infected cells. Essentially, it blocks viral fusion between the cells of the nose and the virus itself, and it's also showing a sustained effect where once the virus particles are actually released from your body, because they in fact produce more than move laterally after being released back into the nasal epithelium, or that nose cavity, it then catches those ones that are released and prevents them from infecting neighboring cells, thereby both blocking viral entry and locally interfering with the propagation of viral replication. Additionally, Iota-Carrageenan nasal sprays have been shown to be safe and well tolerated. For the study timeline, this was carried out prior to the implementation of vaccines in Argentina, and trial enrollment began on July 24th, 2020. Participants of the study were instructed to self-administer 1 puff of the nasal spray to each nostril 4 times per day, where the Iota-Carrageenan was a 0.17% concentration, where there was 0.17 milligrams of Iota-Carrageenan in the solution, and the placebo, which was a saline nasal spray, had 0.9% sodium chloride at a 6 to 7 pH, and it was isotonic. As an aside, it has been shown that the Iota-Carrageenan nasal sprays, when applied to the nostrils, remain in there for about 4 hours. So application 4 times a day results in a reasonable balance between the chance of efficacy and adherence to treatment. And for a quick definition, a post-exposure prophylaxis, a PEP, is a treatment that can stop an infection after the individual has been in close contact with the virus. And it's important to emphasize that this was on top of other mitigation measures. Using nasal sprays and mouthwashes are not meant to replace other measures. They're supposed to be an additional layer of protection. So participants continued to adhere to hand washing, using PPE, and physical distancing. And for the stats they were running, they were doing 80% power analysis at 2 sides with a type 1 error rate of 5%. And this was done to show that COVID-19 would be 50% lower in the active treatment group than in the placebo, where this plot right here is sort of the meat and potatoes of the whole thing. So the red dotted line is the Iota-Carrageenan, the blue solid line is the placebo, the saline spray, and then this is the days of the trial, so from the start to the end at 21 days. So the saline nasal spray, what it shows us is that it's not preventing infection. We see a very consistent stepwise function occurring. What this is showing is that there's a constant rate of healthcare workers getting infected after being exposed to these COVID patients, while on the other hand, the Iota-Carrageenan nasal spray only had a person get infected on day 2 and day 4, meaning that it's very likely that these people were infected prior to the start of the nasal spray. So they were still in their incubation period, and then they got positive after that, very early on in the study. So it's very likely that these 2 are outliers because the rest of the participants did not get infected. And this was true over the course of the duration of the rest of the entire study, which is very strong evidence that the Iota-Carrageenan nasal spray is really effective as a prophylactic treatment, as a preventative measure for not getting infected with COVID, meaning that the Iota-Carrageenan nasal spray would be very effective as something to use prior to going into a high exposure environment, or after going into a high exposure environment. I'd prefer to use it before going into one. So it'd be something that'd be really great to use, like if you're a healthcare worker, if you're a dentist that's exposed to people's mouths all the time, if you're a teacher and around sick kids all the time. This is something that could be very effective in preventing the infections themselves. But again, it probably only has a life of about 4 hours, so you would have to do multiple times a day.